I am happy to welcome you all to our next session, Infusing Health Literacy into Program Design. Before I introduce our speakers, I will say one more time that when we do have an opportunity to speak for Q&A, I will ask you to go to the microphone so that we can be sure everyone hears you, but also so we can be sure that your question is recorded with the recording. I'm very happy, though, today to introduce to you Diana Gonzalez and Olga Molina. They are with the Institute for Healthcare Advancement. Diana is an I should have asked this. Do you say the acronyms after names? I don't know. Diana Gonzalez, MPH, CHES, is a health education specialist at the Institute for Healthcare Advancement. Her role at IHA includes developing and evaluating curricula, including a teen curriculum developed for the IHA book, What to Do for Teen Health. She has implemented programs locally surrounding topics such as health literacy, health insurance literacy, asthma, teen health, and oral health. To help further the field of health literacy, Diana leads IHA's annual Health Literacy Conference and has presented on the importance of health literacy and practical solutions at conferences such as the Society for Public Health Education and Head Start associations. She will be teaming with Olga Molina, who is a peer health promoter or Promotora at the Institute for Healthcare Advancement. She has worked with families in Orange County, California for over 12 years to increase access to care and improve childhood outcomes. Olga has worked with soon-to-be mothers to ensure that they are receiving proper prenatal care and provided follow-up home visits as a lactation coach. She has also worked with survivors of domestic violence to ensure safe housing. Currently, Olga is working with the local senior citizen population to help increase their quality of life and sense of control by connecting them to local resources. So thank you so much. I'll leave it to you.
Linz, thank you for that welcome introduction. So we are from the Institute for Healthcare Advancement, which is in northern Orange County in California. And so while at IHA we believe that some of the important things of health literacy is definitely plain language, white space, and all that great stuff, we also truly believe that health literacy is how are you reaching your target market, where they are culturally, physically, cognitively, and so all those other components that make a person, right? Because if we're not hitting on all those components, then they might not be able to access, understand, and apply health information. So which is the definition of health literacy, right? So we're going to talk about today how we've incorporated health literacy principles into a program that we developed for La Habra residents, particularly seniors. Our session objectives for today, I hope you guys walk away with at least one way to incorporate the community into your program design. So getting their feedback, we're going to talk about how we did a community-wide needs assessment. I hope you also walk away with one way to increase effective communication into your own programs. And we're going to practice one way to pull from a client's strengths to work towards their health goals. And we're going to do that using a health coaching technique. So the program that we'll be talking about is a connection and resource education program. And so just to give you a brief overview what that program looks like, our goals for that program is to provide outreach and referral services to La Habra residents or seniors by encouraging engagement and self-sufficiency, and we hope to do that by connecting them to local resources. Increase participants' sense of control so that they could stay at home longer, and also increase their quality of life.
And I am the Promotora de Salud, a community health worker. As a Promotora, my target is to serve as a bridge between the diverse population and the healthcare system. Members of this target population will be 60 years of age and up. As a Promotora, also the goal is to foster the trust between my seniors and myself. As a senior, I can relate to their concerns and their fears. And with their trust, I can help understand and alleviate some of these concerns and fears. Our program is a 3 to 8 week home visit. My initial 2-hour visit I would be completing a comprehensive risk assessment, which I'll be looking out for red flags as of issues like these red flags would, if they need immediate attention as medical or elderly abuse. The following up visits, an hour, they will be, the topics will be, of course, the three first visits will be my initial visit. The second visit will be setting up goals and Medicare wellness visits. Also will be the reduce of risk of falls. The other visits will consist of getting and staying active, staying healthy, eating well, understanding health insurance, and staying healthy mind. As you understand, understanding health insurance is a big concern, is overwhelming. Every year, plans change, doctors move, plans, medication is not covered, so it's very, very concerning for some of these seniors. Healthy mind, if we have a healthy mind, everything comes nice and smooth.
All right, so who is our target audience and how do we reach out to them? Just to get a brief understanding of where we are in La Habra and our demographics, 26% of our population currently is 55 years and older, and we're expecting that to double by 2040. So the city of La Habra is trying to build that infrastructure now so we can be ready for when the population does double. And also, ethnically, our population is split practically 50-50, 56%, 6% are Hispanic, 43% are non-Hispanic, primarily being white and Asian. And so you might think, well, it's Southern California, so that seems to be about right. Well, the average for Orange County is actually 39%, so you could tell that actually in La Habra we have a higher percentage than the average of Orange County. And these demographics were important for us to know so that we can find a promotora that was representative of this community. And Olga give more description of who our target audience for the program is.
And like I said, my target is 60 years of age and older. At risk. These are my seniors that do not engage in outside activities. We want to help. We want to know what's going on. And this will be due to physical, mental income. We want to help. We want them out. We want them to have a better quality of life. Then we have the semi-active. These are the ones that perhaps they might be doing, they go to church, have a few friends. But we want them to do a little bit more. One of my clients, at that time we were having the senior week, and she was worried that her water bill was too high. That week we were having breakfast with the mayor. I said, well, it'd be good if you can come out and talk to him, tell him what's going on. And also we have the community center. This is where we have lunch on a daily basis, exercise classes, other activities. And lately, we have food distribution. 8 o'clock in the morning, by 8:30, that place is popping. It's just happy because we're giving out food. So my client started coming, and she was just happy because she has more friends now. Then we have the independently seniors that are doing just about everything. But there's always another new activity that we want them to join us, to meet other people. Because sometimes as seniors, we kind of get in a little clique, and we want them to see other people. Locations that we go for outreach, it will be our community center, the federal qualified health clinics, health fairs, and the events of the low-income communities. This will be low-income apartments where we can not only see our seniors, but we can see other persons that might know somebody that would want us to see them have our services. And of course, with everything, there is challenges. We need to develop relationship with the management of these organizations. Sometimes that's a little hard since this is kind of a new program. Also, another challenge is talking one-on-one with these persons. And to overcome these barriers, when attending events, I like to get there early, I would speak with the person in charge of that event so they can take my information, my word to their management. Also, present at the event. That will be classes, trainings. I like to get there early. Most of the time, there will be not so many seniors, but other people that would know somebody. They need to know what program. And I have to know the schedule. I like to get there early, be talking to all these people, because sometimes it gets busy and then I don't have their attention. So it's being there on time.
All right, so how did we develop the rigor into our program, and how did we find the need for our program? So the community needs assessment, we're part of numerous collaboratives. One of the collaboratives is a county-wide Orange County Aging Senior Collaborative, and what they did is they developed an Orange County needs assessment. And they brought everybody together and they said, okay, let's talk about the needs of Orange County. And something that came up with all the service providers was, well, why are we not measuring at-risk seniors, or how come we don't have any data on them? And they said, well, because it's a hidden population, it's hard to reach those seniors, it's hard to count them. And so we kind of bookmarked that and we said, okay, that's an important population that the service providers are bringing up because it's needed, but yet they're hidden. So we kind of said, okay, well, noted. That's something that's needed in the county. It's something that the county hopes to address. They're also looking to increase the amount of wellness visits that Medicare offers in Orange County, where a lot of our seniors aren't taking advantage of that service. So they wanted to increase that within our county. So we thought, okay, that's something that is needed as well. We're also part of the Move More, Eat Healthy collaborative, and that's a city collaborative. Like Olga mentioned, in that collaborative, we started talking about, well, what do seniors need and what could we do for them? And we came up with Senior Week, which was actually developed in Australia. And what it is, it's just a week dedicated to seniors, and throughout the week there's different events going on, such as lunch with the mayor and police chief and the fire chief. We also have like a workout station in a park, and so the local college will help seniors understand how to use that facility. And there's just numerous things that seniors could do throughout the week. But again, seniors have to go out to these events. So again, the at-risk seniors are being missed. So we were like, okay, well, that's something that needs to be addressed. So we talked to our service providers and we said, well, what programs do you guys have for at-risk seniors? And there's Meals on Wheels where they deliver the meals to these at-risk seniors that are at home. But they don't necessarily make goals with them, follow up with them, connect them to resources to make sure that they're improving on their health goals that they've made. There's also St. Jude has a socialization one where they go out to their home, help them with walking and mobility, but according to them, that they have such a high turnover with their volunteers that they can't necessarily train them on a specific skill. So we thought, okay, great, it'd be great to have one person that we can train up and that we can help them with developing these goals and moving forward into reaching some of their health goals. We also, of course, checked in with our residents to see, what they wanted in the community. So we did surveys and we did focus groups to establish a need for this program. So literature, we checked in with literature. And so we thought we were trying to figure out which kind of indicators is important for seniors specifically. And so what kept coming up was sense of control and quality of life are great indicators to check in with that help you to know whether or not a senior is improving in health. And so after we had the indicators, we're looking now into a theory that would help support those, or has those indicators as components of their theory. So the social cognitive model is one that we found that looks at a person's intrinsic and extrinsic motivators to health. So for example, if a person is feeling like they have no control over their emotions, they have no control over their environment, they can't make appointments with their doctors, they're more likely to have decreased health, right? But if a person has higher sense of control, I can control my emotions, I can make a phone call to my doctor, I can control my transportation, they're more likely to have higher health outcomes. So then we looked for models that would support that theory. This is exactly what are we going to do in our program. So we incorporated the Transtheoretical Model, which would test readiness, how ready the person is to make a change in their health. And that helps for them, they're telling you how much they want to change, that's increasing their sense of control. Outreach and Enrollment Agent Model and the Health and Wellness Coaching techniques. We'll dive down deeper into those, first starting with the health and wellness coaching. So the Mayo Clinic found that by using the techniques, just by using these techniques, there's significant improvements in quality of life, reduced depressive symptoms, and reduced perceived stress levels. There's also just numerous studies that show that these techniques are very effective in ways such as increasing medical adherence, increasing exercise, improving glycemic control, fewer hospitalizations, et cetera, et cetera. So we thought this was incredibly important in a program where we're trying to address numerous areas that we incorporate these techniques. So what is health and wellness coaching and what are the techniques? So it's a side-by-side approach where you're working together with the client. And the client themselves are setting the goals and they are holding themselves accountable to the goals that they are making. And most importantly with seniors is they're viewed as a whole person. So we want to know what was their past experiences, what skills are they bringing in, what tools do they have, what does their social connections look like. And because seniors want to be viewed as independent, right? They want to be viewed as a sole person that can take care of themselves. So that's important to pull those things out because it builds self-efficacy in them. And so it'd be a two-way conversation. It's not just Olga narrating something to the senior, and it helps them to process their own growth and change. The most important thing about it is that liability, right? Olga's not going in saying, I'm your pharmacist, I'm your MD, I have all your answers. She's going in saying, hey, I'm your coach, and I will connect you to resources. And if I don't have the answer, I'll help someone that will bring you in. But I'm here to help you set goals and motivate you and to cheer you on when you've made a success or a small success or a large success. I'm here to celebrate those things with you. One of the biggest things with health coaching is that you need to develop that connectivity with them. You need to be able to connect with them. And the way you do that is by really listening to what they have to say. So I want to ask you all, how is some way that you demonstrate to your clients, to your patients, that you are really listening, you're really in it with them? Any ideas?
Active listening.
Active listening? Is there any components of active listening that you'd like to share? All of them, right? Anybody else?
Eye contact.
Eye contact? Yes, absolutely.
I pay attention to body language, how I position myself when I'm speaking to them, making sure my arms aren't crossed, that I'm more open, and I look like I'm engaged. I want to make sure that I project that.
Yeah, so you're not defensive, you don't come off this way, you're open, right? Any other thoughts? Yes.
Having follow-up questions to some of the things the clients say.
Follow-up questions.
That I'm really invested in learning more about what they're
Yes, follow-up questions. Other thoughts? Yes.
Repeating back what they say.
Repeating back, yes, absolutely. So in health and wellness coaching, some of the things you guys brought up too, one of the things, listening without rushing to fix the problem. Sometimes they just want you to experience their journey with them. They want to hear, you just want to tell you their story and not necessarily hear how you are fixing this problem that maybe they don't even need an answer to just yet. Summarize what they just said. So that's kind of like what you had mentioned about repeating back. And it can be a teach back moment also, right, to make sure that you're understanding their story correctly. Ask a thought-provoking question. So this will take you to the next level with their thoughts. So something that you could say is, if let's say if you're working with someone that's like, but I can do it, but this or this person, and they're talking a lot about their barriers, you can ask them about, has there been a time in your life when this really worked out for you? And how did that look? Who was there for you? Or let's say everything worked out perfectly and you had nothing stopping you. What would that look like? And reaching more towards positive. So a half full cup instead of half empty cup, right? Reflect their feelings and then listen to the big five is one of their biggest things in health coaching techniques. So you want to listen for the strengths and the blockers in each one of these sections of focus, attitude, skills, habits, and energy. For focus, what do they keep talking about? Because this might be something that's really important for them. What does the client seem to be repeating? And sometimes they just want to know if they keep repeating themselves, maybe it's that they don't feel like you've heard them. They don't feel like you've heard that this was a really important topic to them. Or maybe they themselves didn't realize how important they were. Example I like to give is if you're talking to like a teenager, right? And she keeps talking about Bobby. Oh, and then Bobby did this today. Oh, and then Bobby, and you're like, oh, I think this one likes Bobby, right? But then she's like, no, I didn't, right? So that could be an instance of when something is really important to somebody, or something is really important, but they don't recognize it themselves, that something's really important. So sometimes just highlighting that lets them know that you're really listening to them. Mindset and attitude. So what is the client's current emotional condition? Has the client just lost somebody really important in their life? If so, moving on, talking about their health goals, that's not where they're at this time. They want to talk about, what they're processing, what they're going through. So being present with them and understanding those things. How do they view themselves and those around them? It's really important so that you can tap into what their social connections look like currently and what their resources are. Skills and capabilities. So this goes back to the idea of that they come into the conversation with their own skills and their own knowledge. And so being able to pull from those things is pulling from their strengths, like we're talking about. So who do you know who's helped you with that before? Does the client know someone that will help them, right? So the most important thing, too, is that when Olga leaves the home and they're no longer part of the program, we want to build that sense of control that they know people, that they can do it, that they've done this before. And so that will help them be on our program. Helps practices and patterns. Are there any habits that they continuously do? Sometimes we have habits that we don't even know that we're doing ourselves until someone calls you out on it, right? And so how are those habits helping them, or are those habits kind of inhibiting them from achieving their health goals? And how can we maybe shift them or even promote, or just say, hey, you're already doing it. You're doing it every day. You probably didn't even notice. And so really just praising them for those kinds of things. Lastly, energy. This can be incredibly important for seniors as well because, if they're on medication and that could be something that's bringing their energy levels down. Or maybe they have a physical impairment as well. So the next thing we want to do is the wellness wheel. So we passed those out in the beginning of the session. And so if you take a look at the wellness wheel, the instructions on the front, the wellness wheel is on the back. So just look at every section and rate each section on a scale of 1 to 5 on how happy you are. 1 is you're not happy at all. 5 is you're completely happy with that area of your life. And then once you're done doing that, just jump to the yellow paper, which has the questions. So normally Olga would do this one-on-one with the client, and it'd be more of a conversation that she would have from them. But what she's doing is she's listening for those big 5s, and she's looking for strengths that she can pull from the client. And so we're hoping to kind of simulate that here with the questions. And so I want you to think about how possibly this might be something that can get you to think about what your strengths are, what you want to work on, and maybe gets that feeling of, I have control over these things. So go ahead, take a moment. Fill those out. All right. How was your experience with this? Any thoughts, comments? What did you think about this wellness wheel? Any thoughts? Yes.
I like that you rate yourself with a number, but you also have the visual of coloring it in. You see both perspectives?
Great. Yes. Yeah. Different perspective, right? These are view things. Yes.
It's also really nice how health is such a big topic for people. It can be overwhelming, so I really liked how it broke it into reasonable chunks that you can then piece apart even more to dig deeper.
Yeah, thank you for that. Yeah, and I think that was really important for us, especially dealing with seniors, right? Because if you just start talking about health, it can go in so many directions, so it helps to compartmentalize everything. Yeah.
I think I like that if you're gathering a whole lot of information here, but it's so, the simplicity of it is just wonderful.
Yeah, great. Thank you. Did you have a comment?
I liked how with the wheel kind of analogy that you used, when you asked the question, how bumpy would your ride be? For me, that really highlighted how interconnected each of these components are to your health. Mm-hmm. So I thought that was really important.
Yeah, thanks. Yeah.
Yes. I thought that the question about home safety was a bit confusing. I really wasn't sure how to take that. Do you mean like personal safety versus like staying in one's home. I thought that was a little subjective.
Right. No, thank you for pointing that out. And that's why it was important for us to have, for Olga to have the conversation with them, because it can mean both. It's just whatever is important to them, whatever they start talking about, because maybe one is okay, but the other is not, right? And so that's why it's important to, we're like, how do we do this with all the people in the session, but not individually, so. Thank you for pointing out. Yes, absolutely. That's why we would recommend using it being an oral discussion. Great. So thank you for that, guys. And after we fill out the wheel, so you can see how it needs to be a discussion, and it needs to be one where we're talking about what are their strengths and their weaknesses, and so what are their resources and so forth. And then after Olga works through the wheel with them, then she starts working towards this action model, this action plan. During this action plan, they make the goals, and then they talk about how ready they are to change for that goal, how quickly they want to start working on that goal. From there, they can start setting the agenda. So like Olga mentioned before, they need to have the first 3 visits, so the initial visit, and then the wellness check and setting the goals, and then the third one is the risk assessment, or the fall risk assessment. And then after that, it's up to the client to say, these are my goals, these are the things I want to work on. So that helps the client, again, to build that sense of control, increase their independence, and has been shown to improve the quality of life. Another model that we use is just this outreach enrollment agent model, where Olga will go to the homes, and by going to the homes, it's helping to reduce social isolation. She assesses the environment for the safety inside and outside of the home. She's able to offer one-on-one advice to them if she'd like. And then also she can make referral to our partner, our care partners.
And my care partners will be Home Depot. Home Depot is a chain of home improvement. They have a program right now for seniors. They will come to, we'll go make a visit, see if they need any small improvements inside and outside. There is not a lot of money there, but it's a service there. We have the Senior Serve, that's the Meals on Wheels. This is run by volunteers. They take our seniors lunch and dinner. This person will call me they want me to go talk to them, see what's going on. Do they need the full 8 visits or just 1 or 2? Or what kind of resources I can give them. We have the La Habra Community Center, which I give them referrals, and they also give me referrals. It's a pretty big community. The other partners will be the nonprofits. We have Love La Habra. It's a community-run, it's a program run by volunteers. This is Love the community. They clean up. They go to some some seniors. They clean the yard or clean windows, and if they continue with a relationship, maybe they will go other times during the year. We have this PACE program. It's also a community center outside of La Habra. It's a bigger one. They do have transportation where they will come and get this. My seniors take them, and at the end of the day, they will bring them home. They also have some nurses that would check on the blood pressure, the diabetes. It's a one-shop all. That is a good program there. And then we have the local colleges where some of the students will come and they will check on their balance, how they're doing. They go with them on walks. They do some type of visit. And then we have the nurses, students that come. They do preventive. We like to sometimes collect all of our little medication bottles. Some of them are expired, some of them are just not, they don't have a refill. There's nurses that will come and assist with that, and sometimes they would help make the call to the doctor or the pharmacy for a refill. A great help there. Then we have church, which they go, they have their spiritual wellness. They also have their friends there. They also have some referrals from them.
So how do we test for effectiveness in the program? So we assess quality of life using the Older People's Quality of Life Brief Questionnaire, which is a validated tool. It's only 13 questions, and the great thing about it is that it includes a sense of control metric. And sense of control, again, was so important for us to measure because it improves psychological and physical well-being. And you can imagine what I've mentioned before, like if you are having a hard time accessing your doctors, if you are having a hard time with transportation, you can see where this can spiral down, where you can now lead to depression and social isolation. We were initially going to do a quality of life questionnaire and also a sense of control questionnaire. There's a sense of control 3, what the other one's called. But Olga sat in with us when we developed the curriculum. And so she was like, okay, this is too many forms, you guys. So we found this one, the Older People's Quality of Life Brief Questionnaire, which only had 13 questions and included sense of control. So we're like, all right, if it's Olga approved, we can test it out and see how it goes. Now we're going to talk about some effective communication techniques and what we've done written and what we're doing verbally to improve effective communication. So the curriculum is, like I mentioned, Olga sat in on it and helped us to develop it. As well as we use a 12-point font, we recommend that for seniors, and also using sans serif such as Arial or Calibri. We have Teachback examples written into the curriculum. So Always Use Teachback is an amazing website that you can go to get training for Teachback. But then after that, you're kind of left alone, right? You don't have any kind of support for it. So we've included some Teachback prompts that she can use while she's with the client, just in case she needs one of those prompts. You know, for maybe if you're not familiar with Teachback, there's always these prompts like, what is something you would tell, the popular ones, what is something you're going to tell your neighbor when you get home about this? Or what is something you're going to tell your husband when you get home about your visit today? And so you can kind of use those up really quickly. So it's nice to have something in the curriculum that she can refer to readily that's fresh and new, especially if you're meeting them every week for 8 weeks. You know, you kind of need something new. We use plain language, of course. We reference the Federal Plain Language Guidelines, and we always test our material for its grade reading level. The program material is exactly the same, except for the fact that if we pull from an outside source and we find that it's not working within our parameters, we then will rewrite and redesign the material. For example, this is the older adult quality of life questionnaire. What do you guys think about this? Good? All right. Not so good. Not so good, yeah. What was something that you would change, or why do you think it's not so good? Any thoughts?
Uses a lot of words in small areas and the font size. Mm-hmm. Seems to be a bit challenging.
Right. This could be a little bit just because of the screen, but yeah, no, definitely font size is important. Yeah. Any other thoughts? Yes.
I mean, I'm far away, but I can even see lots of acronyms and maybe some jargon. It might be complicated for someone to fill out.
Absolutely, jargon, right. Yes, so we took this document and we rewrote it quickly so that we can have the instructions all at the top. So when Olga's going through it, she's reading it with them, and it's more conversational. We also broke down the boxes so that they can follow along with the questions and responses a little bit better. This is 12-point, and the boxes are 15. So once you print it out, it's, again, Olga approved. And another thing they did, the Sense of Control 3 validated tool, they recommended for their tool that when you work with seniors to have just the 3 responses. So this tool didn't do that. It has 5 responses, you can see from the last 4. So we just broke it down to 3 for the last, it's actually 13 questions in total. But so we're just testing that out to see if we can use that principle with this quality of life tool.
And when I do my home visits, I take my senior kit box. This little box with a few items. One of them being the what to do for senior help book. Everybody got one? Yeah.
If you
For me-
didn't get a
Okay.
senior book, we can ship you one for free if you'd like. There's some handouts in the back. Scarlett is helping them. If you want to just fill one out, we'll be happy to send it to you.
This book is a great tool for me. It helps me a lot because it has a lot of questions that most of my seniors have. Then we have the Advanced Healthcare Directive. We have the Fall Risk Assessment, which also,
Fall risk assessment.
yes.
Advanced C.A.R.E directive.
Yes. We have my flyer, of course. And we have our senior resource guide, which is this. We have Medicare and You, and then we have answer book. This is just what's happening in the OC in Orange County. A lot of resources are great for my seniors. And then we have some goodies. We all like goodies. We have our little pill box. Sometimes we need a little bigger than this. We have a smaller one, but what I hear is we need a bigger one. And then we have a little light. So this is what I give to all my clients. It comes in handy for other things.
So now the effective communication portion, what the verbal tips and tricks that Olga uses with her seniors.
And going back to trust is I listen. I validate their feelings. I invite them to my place of work. I want them to know who I'm working for is a great place. Sometimes when you hear programs that are too good to be true, most of the time they're not. But mine is a great program. So when they come to my place, they see that we not only have resources for seniors, we have for the whole community. And if I don't have the resource, we'll look for it. There's many of us working there, so. I'm also, like I said, I'm also an additional resource. We'll find that resource. And then we have to let them know that if I'm offering to do something for them, I better do it. I stick to my word. We have the knowledge. We have all the resources. And to show my knowledge, it's just so many ways to let them know what we know. I let them know what to expect when they do if they have an office visit, a doctor visit. Nowadays, it seems like it takes longer to go to certain places. So how long are they going to wait? Do they need additional documents? What other questions are they going to be asking? Be prepared. Make sure they know what to expect from this visit. And you can do it. It takes longer for some of us to do certain calls, ask questions. I had this client that came in and they said, I'm looking for you. They said that you could help me. I said, of course. I said, I had a dental appointment a couple of months ago and I couldn't make it. I'm trying, I have to go back. They cannot help me. I said, okay, let's look at your medical, your insurance card. We called. They said, yeah, she has an authorization pending. Gave me the number. What is that this authorization will be paying and what they will not be paying for. I wrote everything down. I said, this is what you'll be taking to your office. It's ready to go. She goes, I was on the phone for hours. It took you 5 minutes. And I go, it's very simple. Just listen, when you make calls. Come back anytime. And she was just happy. So simple. She says, okay, then I'll be telling my friends about you. And I said, that's what I want. What is called the comadre, I don't know if everybody knows, but comadre is the network that we call it. So this is what I need. So that's great. So that's showing them how to do things. And they're able to do it. Very simple. That way they don't get so frustrated. I also, I give them a stepwise process. We like also to collect a lot of our items, a lot of papers, mail. I like to organize them with this little handy kit box. We can put the most important ones. The last one that they need maybe some attention in the next week or so, and then throw the other ones as decluttering. I don't know why we like to collect all the mail. I have gone and I went through a whole year of mail. I said, a good time to spend and get to know her a little bit. When we put the most important ones here, I like to highlight a doctor's appointment, the doctor's name, the phone number, the date and the time of the appointment. And this is because if somebody's going to take them, they have all that information on hand. Or if they're going to, well, most of the time, somebody's taking them. So they have everything on hand, everything ready to go. And then I also like to set boundaries. It's both ways. We were at the food distribution, and then one of my clients says, "Can you get in line for me while I go over here and you can?" And I said, "Well, no, we're cool, but okay, no." Not for this, I'm talking, so you go get in line and get your food. Yeah, so that's working with seniors is fun. It's fun. And looking back on what I look as, for abuse. It takes time. It takes time to have. Once I have their trust, it takes like maybe 2 to 3 visits so they can confide what's going on, what's happening. And looking for the signs, the physical, the emotional, financial. Physical. We bruise so easily. I hate that. We bruise like any little thing, but when I see a big bruise on their arms, their face, what's going on? What's going on? Emotional. I can see their eyes. And then financial. They're not eating right. They don't have enough money. They're not paying their bills. Why? Who's taking care of them? Is it a caregiver? It's a family. But then on the other hand, they're here to help me. Who's going to take care of me if I say anything? So it's very challenging. It's heartbreaking to see some of these things. They need a better quality of life. So this is a key for me. I want to make sure that they're doing okay. I want somebody to look after me when I get a little bit older. So this is big on us.
All right, so the last thing we're talking about is the maintenance stage. So we are in early inception in this program, so definitely piloting. But what we want to do now is assess our partnerships. While we were working on the development of the program, Olga mentioned, the one thing that's important is who we're referring our clients to. Because if we send them somewhere and they're not answering their phone, it's hard to get a hold of, they might drop out. And then our dropout rate is going to be high for our program. We also want to increase referral services. Primarily, we're looking into the FQHCs to see how the providers can prescribe our program. So when the patient goes in to meet the doctor can help them medically, but if they start talking about their thermostat's broken, their fence is broken, and all the other issues that might be going on at home, the doctor can then say, here's a program that can help you that I trust, that'll help you with some of these issues that you're talking about. Lastly, what we're looking into next would be decreasing client paperwork load, and hopefully we can use that with the wheel. As you can tell, it is using a Likert scale, so if we can move it from qualitative to quantitative. But also, it's a physical representation, right? So if they could see how they've changed from 1 week to the next, or from what beginning of the program to the end, then they can physically see that growth. And so that's a great way to incorporate the health literacy principles into evaluation. So we're going to try to see how we can finagle that. Besides that, that's all we have, and it's definitely a team approach. So it's Olga and I. Scarlett in the back has also been amazing in helping in this program. And Rachel Roberts, she couldn't be here today. She went to Cabo, so, Wisconsin, Cabo. And this is our contact information. And if I can throw in, this is Olga's first presentation.
As you can see.
So what questions do you have for us? I think we have a couple minutes, if you have any questions. Oh, and use the mic if you have any questions, please. If you can stand up to use a mic. Yes, go ahead.
Thank you for the information. Do you have your clients sign any type of confidentiality statement?
Yes. Great question. So like I mentioned before, we are part of the La Habra Family Resource Center, and so there are numerous documents about confidentiality and not sharing this with other individuals. Also about Olga being a mandated reporter, to letting them know that if she does see any signs of abuse, that she is mandated to report the abuse as well. Any other questions? Yes. Or Mike.
Just your last statement about sustainment, you said that you want FQHCs to prescribe this. Is there a way to get reimbursement or money? I know through research or...
Yeah, that's a great question. I wish I could look for that. I don't know that it would be so much that we would go to the program or we would go to the clinic itself to it be a service that we provide at the clinic, as much as it just be another referral that the doctor can make. I think the most important thing is that because especially in Hispanic culture, doctors are like gods to us. Whatever your doctor says, it's like, okay, I'll do it. And so if that's our target audience, if the doctor said you should go to this program, they're more likely to come to our program. So yeah, that's a great thing to look into, to see if there's some way that we can get it working both ways. Probably motivate their management to help us out too, right? Any other questions?
And our book is also in Spanish. We have Spanish and English.
So your senior resource kit seems like a great resource for seniors. It also seems like it's a lot of information. Do you help them go through it in pieces, or how do you handle the quantity that you're giving them of paper?
It's a great question.
Yeah, most definitely. It's just depending on their need. Of course, I will go in detail who's going to help, how long it's going to take, and if they need to complete forms, I'm there. Yeah, it is a detail, of course. Yes, everything.
And then also the book we recommend for the clients, it's pretty dense, and so just to look at it in pieces. So read it find whatever they need at that time and find that information in the book, and then put it in an important spot to check back later if there's something else that pops up. Yes?
Yeah, thanks. You talked about having 3 to 8 visits, but I'm curious, do you have any ongoing connection with some of your clients, or is part of your work to try and connect them to other means or resources that may be some ongoing issues that they may have? Or they have other supports? Or is it kind of 8 weeks and you hope you don't see them?
We are friends forever. Yes, anything. After one of my 8 visits, my client comes back, she says, I forgot to complete this form. It has to be in to Medicare tomorrow. And I said, okay. One of my co-workers, she was happening that she was going to Medi-Cal the following day. She had a couple of visits there, so we'll take it in person for you. We'll take it in the morning, they'll be handed in, and you'll be good. And that's how, they come back. We're there for them, for anything.
And I think it helps that we're part of the family, they are the Family Resource Center, so it's open to everybody. So if there are other issues that might pop up, that they need case management or counseling or so forth, those are available at the Resource Center as well. All right, I think that's it. Thank you all very much for your time and support.